Good morning, everyone. Before we begin our hearing today, if those of you who have electronic devices, please make sure we silence them. It's a pleasure to have everyone here today for this combined Agriculture and Rural Affairs Committee and our Health Committee together as we discuss our concerns about the avian flu, the influenza from our birds to cattle, and now, unfortunately, to people. As the avian influenza continues to be found in domestic and wild birds and other animals across the country, it is critical that we as legislators and the public understand the threat that it poses to our health of our animals and people alike, as well as the implications moving forward. I want to thank, first of all the testifiers here today from University of Pennsylvania, our School of Veterinary Medicine, for being here to guide us through this challenge, and your opinions are extremely critical on this important topic. I also look forward to the discussion and to the hearing the insights of how we can ensure that Pennsylvania stays on top of and ahead of this evolving threat. The well-being to our animals, our residents, and our agriculture economy, which certainly includes $7 billion for our poultry industry. And now I'd like to hand things over to Representative Kozorowski, followed by Chair Rapp from our Health Committee for her brief remarks.
Good morning. Good morning. And thank you, Chair Paczynski, for kicking this off and convening this meeting with both committees on health and agriculture. I'm grateful today to stand in for Chair Frankel during this meeting, and I'm particularly interested in the topic of avian influenza, bird flu. As a healthcare provider myself, and knowing that we all just lived through one pandemic, and quite frankly, I think I speak on behalf of many of us in this room, we do not want to have to live through another. But what we are hearing is scary, and people are afraid. You know, we already see bird flu affecting our purchases at grocery stores, and people have a deep concern about continuing spread to human. Obviously, I'd like to hear there is nothing for us to worry about, but bearing that, I'd like to hear from our experts here today, their opinions about the science behind transmission and what we should be doing here in Pennsylvania to protect our food supply and public health. Thank you very much for all of you for being here today, and I want to thank the testifiers from the University of Pennsylvania School of Veterinary Medicine for being here to offer their expert opinions on this critically important topic. And I'd like to introduce now Chair Rapp from the Health Committee.
Thank you, Madam Chair, and thank you, Chairman Paczynski.
Chair.
I, as well, am very much looking forward to the testimony today and the information that you will share with us regarding your research. As Chairman Kozorowski stated, we've been through this with COVID, so many of us are concerned, especially regarding vaccines, especially after what we have learned now through much testimony, specifically in at the nation's capital. So I'm sure many of our constituents all across the state are very concerned, have many concerns about the direction that the state will take in regard to how we move forward. So thank you for being here and looking forward to the testimony. Thank you, Mr. Chairman.
Thank you very much, Madam Chair, and perfect timing. Our guest speaker for today, our co-chair of the Ag Committee. Would you like to say a few words?
Thanks for being here.
Is that it?
Let me get my feet in the ground here. I just walked out of a meeting, have my head somewhere else.
That was the shortest welcome I've heard. Well, but we're happy that we're all here, and thank you so very much to all the members of both committees for being here today. Once again, the importance of this issue is beyond words. So at this time, I'd like to introduce Dr. Andrew Hoffman, the Dean of our University of Pennsylvania School of Veterinary Medicine, for opening remarks. Yes.
Thank you, Chairman.
By the way, we will hold the questions till the end. After all of you present your testimony here today, then we'll open it up for questions. And to be clear, those of us that are here today will get the preference of the questions. Anybody that may be online, unfortunately, once we take care of the questions here, then I'll open it up to them.
Great.
Doctor, it's all yours.
And we will make sure there's time for questions. Thank you, Chairman Paszynski, Chairman Moll, Secretary Kozorowski, Chairman Rapp, and everybody on the seats above. We are thankful for you convening this informal meeting on highly pathogenic avian influenza and share your concern. And so, and we also want to thank you for your ongoing service and support for efforts to contain the disease in the Commonwealth. So today, from the University of Pennsylvania, we're joined by 3 leading infectious disease experts across veterinary medicine and human medicine, including Scott Hensley from the medical school. So there's a veterinarian and the medical school represented here. And they will provide a state-of-the-art overview of what we know about the virus and ongoing work at our institution to address the current HPAI outbreak. Our goal today is to brief you on where we stand as a country, show you how the virus has spread geographically in the United States and among species, explain the threats this virus poses to our agriculture and wildlife industries, as well as to humans, nationally and here in Pennsylvania, and update you on work at Penn to develop vaccines to safeguard livestock and poultry species, as well as humans. And importantly, as was mentioned, to prevent this outbreak from becoming the next pandemic. So HPAI is caused by the H5N1 strain of influenza type A. In the last 2 decades, infections with H5N1 around the world in humans have mainly occurred in the Western Pacific region, China, South Asia, arising from close contact of individuals with domestic chickens and ducks carrying the virus. Often they carry it asymptomatically. From 2003 to 2024, there were 954 human cases of H5N1 in that West Pacific region, with approximately 50% mortality. So influenza A has the ability to be highly fatal or to be a mild infection across the spectrum. H5N1 strains different from those identified in the Western Pacific region that I just mentioned were introduced from migrating waterfowl into North America in 2022, resulting in the reemergence of HPAI with obviously devastating consequences to poultry. 162 million birds have been lost since 2022, with approximately 10% of the United States layers being lost in just the last 3 months. In March of 2024, it was also detected in, as mentioned, dairy cattle for the first time in the United States. Now it's been found in dairy cattle in at least 16 states. HPAI in cattle causes illness, decreased milk production, and 1% to 2% mortality, resulting in substantial economic consequences borne by farmers, in part due to the more limited indemnity that is afforded them compared to the poultry industry. Infections in other species of wild birds and mammals, for example, cats, cause illness and death in those species. Of the 68 humans in the United States to have contracted the virus since the beginning of 2024, 1 person with underlying medical conditions in Louisiana died on January 6, 2025. On February 14th, 2025, a woman in Wisconsin with similar pre-existing vulnerabilities was hospitalized with an H5N1 infection contracted from poultry. Multiple herds of dairy cattle have recently turned up positive in the milk for the H5N1 genotype D1.1. We'll probably be hearing a little bit more about that. That was the strain that was also found in humans with H5N1, including the Louisiana patient who died. So we can draw a thread between the human patient that died and the strain of virus in dairy cattle. This indicates that H5N1 is repeatedly introduced by wild birds on each of these farms, not just spread, from cow to cow. And that heightens the concerns about biosecurity in the dairy industry. To be clear, no human-to-human transmissions have yet been identified, but a priority of surveillance in the country remains the detection of human-to-human transmission consistent with pandemic potential. Despite enormous resources and efforts devoted to biosecurity measures in poultry and livestock, HPAI has not been stamped out in the United States. Many new confirmed cases in commercial poultry recently in the Commonwealth have underscored the urgency of combating this outbreak. Further, the virus appears to have adapted for sustained endemic infection in wildlife populations, making it unlikely to dissipate as a threat in this calendar year or anytime in the foreseeable future. Just as the virus has changed over time, our approach needs to adapt and evolve, enabling us to respond appropriately to the emergence of new substrains of H5N1 and to address a long-term threat to animal agriculture. So only by working collaboratively across human and veterinary medicine and across academic, local, state, and federal laboratories and agencies can we protect people and animals from HPAI. The overarching goals of this control must include these three things. 1, tracking new animal and human cases and their origins. We can't let up on surveillance. 2, monitoring changes in the virus that make it more adaptable and transmissible. For example, full risk assessments, as they're called. And 3, observing any modifications in the virus that make it more resistant to the current stock of antiviral medications or to the potential to vaccinate. Consistent with these goals, national goals, the University of Pennsylvania continues to conduct diagnostic testing and field surveillance of domestic animals and a wide range of wildlife species, performing risk assessments of the virus's potential to emerge in human populations based on its ever-changing biology, and public outreach and education about food safety and biosecurity through the media, as well as vaccine development in domestic animals and humans. So leadership from this work comes from Penn faculty who are here today who head the Pennsylvania Animal Diagnostic Laboratory System at New Bolton Center, the Wildlife Futures Program, the Penn Center for the Excellence in Influenza Research and Response at the Perelman School of Medicine, and research laboratories in the Department of Pathobiology at Penn Vet. Of critical importance, the work out of Penn involves numerous collaborations across the Commonwealth. This is critical. The Pennsylvania Game Commission, the Pennsylvania Department of Agriculture, the Pennsylvania Department of Health, and the USDA. So we are most fortunate to have these partnerships. Continued support for these collaborations will be critical to our success in mitigating the risks of this outbreak. So I'm just going to very quickly, in an abbreviated fashion, introduce our speakers and then hand it to Dr. Moncla. First, we're going to hear from Dr. Louise Moncla, Assistant Professor of Pathobiology, University of Pennsylvania School of Veterinary Medicine. Second speaker will be followed by Dr. Lisa Murphy, who is the Professor of Pathobiology and Resident Director of Paddles at New Bolton Center, so you may have met her in other contexts, at the University of Pennsylvania School of Veterinary Medicine. She's also the co-director of the Wildlife Futures Program. And third, we'll hear testimony of Dr. Scott Hensley. Dr. Hensley is a professor of microbiology at the University of Pennsylvania School of Medicine and director of the NIH-sponsored Penn Center of Excellence for Influenza Research and Response. We call the Influenza Center. So first we'll hear from Dr. Moncla. Dr. Moncla, the mic is yours.
Okay, wonderful. Thank you all so much for having us here today. As a native Pennsylvanian, it's a real honor to be here. Next slide, please. Okay, great. So my name is Louise Moncla, and our lab makes family trees of viruses to track viral outbreaks. Next slide. So we've probably all made a family tree before. So if I went to 23andMe and had my genome sequenced, my genome would tell me that I'm directly descendant from my parents, and those are my real parents. And then if we went far enough back in time, we would eventually hit my great-great-great-grandparents who came here from Iceland and from France. This exact same concept is true for every organism, including viruses, and we can use virus family trees to make inferences about how outbreaks are spreading. Next slide. So the equivalent of 23andMe here is the Pennsylvania Animal Diagnostic Laboratory System. So if there's a farm in Pennsylvania where some chickens start to become sick, we can go out and swab those chickens, and if they test positive for highly pathogenic avian influenza, the samples get sent to the USDA and that virus is sequenced. Next slide. Once we have that viral sequence, we can then compare the viral sequence from that outbreak to every other virus sampled across the United States and use that information to make an inference about how transmission is proceeding. Next slide. For example, if the most closely related virus infection was sampled from the farm that's just down the road, that would tell us that there's probably some degree of farm-to-farm transmission happening. So perhaps we should focus on reducing the movement of people, equipment, or animals between those two farms. Next slide. In contrast, if we found that the most closely related infection was sampled from a wild bird, that would tell us that perhaps this outbreak was started by a wild bird that reintroduced these viruses into this farm, and we should focus on keeping wild and domestic birds more separate. Next slide. So our lab has been making family trees of these viruses in North America to try to understand how H5N1 viruses got into North America and why they've been spreading so successfully despite some very aggressive outbreak response. Next slide. This is an actual family tree of H5N1 viruses sampled globally, and this is current up to about 2025. The way to read these family trees is that time goes forward from left to right. Every circle represents one unique viral sequence sampled from an individual infected animal, and the color here represents geographic location. What I want you to see on this slide is that the vast majority of viruses sampled in the United States form this one red cluster at the top of the tree that's big and branches off an orange branch, indicating viruses from Europe. We know that these viruses were initially brought into North America by wild migrating birds that were migrating across the Arctic Circle from Europe into North America that brought these viruses in late 2021 in Atlantic Canada. And this introduction then rapidly spread across the US. Next slide. We also see that there's a couple of red tips at the bottom here, representing a tiny cluster that nests within the diversity of viruses circulating in Asia. So independent of that introduction from Europe, these viruses were independently brought to North America by migrating wild birds migrating from Asia into the Pacific coast. Next slide. Once these viruses were introduced, they've started an outbreak that, of course, has continued until today. What I'm showing you here are case detections in wild birds, domestic birds, mammals, and domestic dairy cattle from 2022 until 2025. One thing that's been really challenging about this outbreak is that these detections have continued to happen, particularly in domestic birds, despite some very aggressive outbreak response. To compare this to an outbreak that we had in 2015 with related viruses, we had a similar outbreak back then, and the US culled about 50 million domestic birds, and then transmission stopped. Today, the US has culled over 160 million domestic birds, and we are still finding new detections as recent as last week in wild and domestic birds in North America. The reason for this, next slide, is that in contrast to past outbreaks, which were predominantly spread by commercial poultry, the viruses that are circulating now have established in wild bird populations in North America. And this establishment in wild birds has three important implications when we think about long-term control. The first is that because these wild birds are migratory, these viruses can be spread very far geographic distances very rapidly when these birds migrate. The second important implication is that because these viruses have now established and are continuously circulating in wild birds, agricultural outbreaks can be repeatedly reseeded from these wild bird populations, so we can get new introductions from wild birds that then sometimes subsequently spread from farm to farm. Next slide. The third important implication is that these viruses can now start to mix with other viruses that are present in our wild bird populations in North America. There's an enormous diversity of low pathogenicity avian influenza viruses that circulate in our wild birds in North America, and the vast majority of them never go on to cause us problems. These viruses are always getting shuffled in the wild bird reservoir by a process called reassortment. Reassortment happens when two distinct viruses, shown here as red and blue viruses, co-infect the same animal. During its replication cycle, these viruses can mix together and make genetically new combinations of viruses within that infected animal. This type of mixing event recently occurred and produced a new type of viruses called D1.1. Next slide. These D1.1 viruses are the ones that are currently predominantly circulating in wild birds. They were the source of the recent die-offs in snow geese reported in the Lehigh Valley. They were also the source of recent severe human infections in British Columbia as well as Louisiana, and they're also responsible for all of the commercial poultry outbreaks that are currently happening in Pennsylvania. Next slide. If we go back to our family tree and we update it with data from the D1.1 outbreaks, I've pointed them out for you here with an arrow, and you can see that they are this growing cluster of viruses at the bottom of the tree. These viruses are spreading currently really, really well in wild birds. They've really taken over transmission in wild birds, and they're currently causing a lot of problems for agriculture. So when these new viruses get formed in this wild bird reservoir, they can lead to problems for agriculture as well as increased human infection risk. Next slide. Until 2024, these viruses were primarily causing problems for domestic birds, but in March of 2024, these viruses were detected in Texas dairy cattle. Since then, this outbreak has spread to 17 states and affected over 900 herds. Next slide. If we look at our family tree one more time, we can now color this tree by host species. And so I'm highlighting here for you cattle outbreaks here in orange. So what I want you to see here again is that there are 2 clusters of orange tips here. And that tells us that these viruses were introduced into dairy cattle at least a couple of different times from birds into dairy cattle. The large cluster at the top of the tree was the result of our first introduction. We estimate that this happened sometime in the winter of 2024 in Texas, and that those viruses were subsequently spread to other US states by cattle movement. This tiny cluster of viruses at the bottom here represents recent introductions of D1.1 viruses into dairy cattle in Arizona and Nevada. Currently, only a small number of cows have tested positive for D1.1 in Nevada and Arizona. However, given how common and frequent these viruses are in wild birds right now, we may find more detections or more spillovers as this outbreak continues and testing continues. Next slide. Once these viruses get into dairy cattle, they can then spill back into poultry, domestic cats, and into humans. What I'm showing you here is a map of where these cattle origin viruses have been found, where the size of the circle represents approximately the number of infections that have occurred, and the color coding here represents host species. Currently, you'll see the largest circle in California because California is currently harboring the most infections of these viruses. One thing that's been very challenging about these cattle outbreaks is that once these viruses get into cattle populations in a particular state, they transmit very well, and it's very hard to stop transmission from proceeding. This can lead to problems for agriculture, so farmers have to dunk milk, and it also leads to human exposure risk. Currently, Pennsylvania is doing an incredible job of testing for these viruses. So Pennsylvania is doing a really great job of testing individual cows as well as bulk tank milk to try to figure out if our cows here have these viruses, and currently we don't. So this is something that's really important because this proactive, active testing allows us to hopefully find outbreaks sooner and prevent them from spreading onward. Next slide. All right, so some key takeaways from this overview. Since 2022, these viruses have been circulating continuously in North America, spread by migrating wild birds. Because these viruses are now well established in wild birds, it means that these viruses can rapidly spread across geographic space, they can repeatedly spill over into domestic poultry, and they're also mixing via this process called reassortment. Until recently, the outbreak in cattle was caused by a single introduction from birds, followed by dissemination between cattle by cattle movement. But then recently, D1.1 viruses have now spilled into dairy cattle twice. Finally, strong testing, surveillance, and outbreak response are really critical for outbreak mitigation, and this is an area that I think Pennsylvania is currently doing really, really well. Next slide. The last thing I'll leave you with is that all of these family trees are actually publicly available on a website that I maintain called nextdrain.org, so if you'd like to check them out, they're publicly available. And then I'll pass this off to Lisa.
Great. Slide, please. All right. Better? Excellent, thank you. All right, so Dr. Moncla has done a really good job of basically telling the story of how did we get here. And so my job is to maybe give you a bit of a picture of what here currently looks like. One thing that I just want to come back to that's really important is the fact that our Paddles New Bolton Center laboratory is part of the USDA's NALN system. So that's the National Animal Health Laboratory Network that we've all heard a lot about in the news recently. That is extremely important, not only in our ability to provide testing here in the state of Pennsylvania for this regulatory disease, but it also gives us the ability for 2 other things. It lets us actually receive back the viral sequences from our own in-state detections, and it also gives us the ability to retain the extracted nucleic acid. So it's not the live virus, but the material that can facilitate the type of research that you've just heard about. All right. So we're going to start with a national snapshot here. And so this is information, again, by the NALN that's maintained. This is cumulative data, and it's updated on a weekly basis. So you can see this is from about a week ago. And so I actually have the hot off the presses numbers from yesterday. So if you'd like, you can follow along and just hear about what's happened in the last week. So as of February 24th, There's been no change in the number of activated labs, so 58 NALM labs across the United States activated in 42 states. It's important to note that our 3 Paddles lab system here in Pennsylvania is counted as a single NALM lab. In terms of the new numbers for domestic birds, so from last week to this week, we've gone from 451 to over 460,000 PCR tests now run. And this is also then bumping up the other numbers as well. So we've gone from over 162 million birds. The new number is now over 166 million. So just thinking about that change in the last week alone, with now 762 commercial flocks and 838 backyard flocks infected, 973 confirmed livestock cases, and 504 detections in other mammals. The other thing that's really important to point out, this is the number of PCR tests, and that does not equal the number of affected animals, right? So going into a flock or going into a herd, you're not sampling every animal, you're getting a representative number to do the diagnostics. Again, thinking about this being cumulative data and updating it weekly, I'll take it back. It started, this map goes back to February of 2022. Here in Pennsylvania, our story started on Thursday. I remember the day of the week distinctly, Thursday, April 14th, 2022, when a 1.4 million bird commercial layer flock in Lancaster County tested presumptive positive. And this turned out to be the first case of confirmed highly pathogenic avian influenza in our state in poultry in nearly 40 years, right? And then, along with that, our first 2022 wild bird detection had been a little bit earlier. That was on March 22nd, 2022. It was actually a Chester County eagle. It was recovered very close to the Paddles New Bolton Center lab where the testing was done. I kind of think to myself that it was trying to fly itself in so we could do the diagnosis on that bird. Yep. And also just because it was pointed out earlier by the chairwoman that, at this time, we still weren't fully emerged from COVID either, right? So in just thinking about sort of the posture of the lab and, having people there and doing this high level of testing to ramp up when we were still in somewhat, of a state of unknown at that point. All right, next slide, please. All right, so now we're going to bring things a little bit closer to home, and in terms of we've been all very busy at your Paddles laboratories here. So over 20,000 samples collected from domestic and wild birds and mammals at Paddles New Bolton Center alone. So just to think back from that previous slide where the total number of samples tested nationally was 460,000, and then you take that 20,000 and multiply that by 3 with the other 2 Paddles laboratories doing similar numbers of tests, you get an idea of just how much testing has been done here in Pennsylvania alone over the course of this past 3 years. But it's also important that this would not be possible without coordination and collaboration between not just our poultry industry and now our cattle industry, but also the Pennsylvania Department of Agriculture, the U.S. Department of Agriculture, the Pennsylvania Game Commission has been mentioned, but also Paddles and also Wildlife Futures Program, faculty and staff at Penn Vet. All of that coming together to give you this system that you have in place. For us at New Bolton Center, this has most recently also included some non-negative samples that have since been confirmed that were collected and tested from a Philadelphia live bird market on February 21st. The map that I have up here, this is something that's available on the Paddles website, so at paddles.agriculture.pa.gov, where you can actually visualize where we actually have had positive cases. And the primary intent of this is really to help inform producers of the necessary actions that they may need to take in terms of movement testing and other surveillance activities. For 2023 and 2024, we've been testing at the level of about 7,000 domestic poultry samples per year. That's a lot, especially when you consider all of the other disease and surveillance testing that our laboratory system has been doing all along. And then you add in the wildlife samples as well. So in 2023, New Bolton Center tested 120 wildlife samples, and in 2024, it was 87. Keep that in mind when you see our next slide, please. All right, so I'm going to switch gears to wildlife a little bit too, and we sent these slides into you about a week ago, and just to give you an update, so since that 101 non-negative and or confirmed wildlife samples, since January 1st, 2025 alone, we've added another 15 positive birds in the past week from 11 different counties here in Pennsylvania. It's also important to point out that our cumulative total from March 2022 through May 2024 was only 124 wildlife cases. So that represented 119 birds and 5 foxes. So we've certainly started off 2025 with a bang. In January alone, we tested 144 wildlife samples. So sometimes, sometimes they're negative. But these are coming from throughout Pennsylvania. So what you're seeing here displayed on the map in the different colors, I'm sorry that may be a little bit small, is you're seeing a representation of the positive tests that is different than the total number of tests and where those tests have come from. And this is largely made possible by our collaborative efforts between the Pennsylvania Game Commission and our Wildlife Futures program, specifically utilizing 7 field-based wildlife health technicians that work out associated with every Pennsylvania game region. They can very quickly respond and make sure that we're getting these very valuable, important samples in for testing in a timely manner so that information can go back out. And they are also, this was part of our program, sort of, looking forward to how we would get the best utility out of these people, is that they also are all certified poultry technicians, which is important when it comes to people that are properly trained and qualified to collect important regulatory samples. All right, next slide, please. All right, so just to finish up a little bit more details, people always have questions about species and how things have changed. Dr. Moncla mentioned the snow geese, which is certainly up there, but the top bar is actually still the Canada geese. Interestingly, when we sort of went through this before, that sort of 2022 to 2024, we previously had many more black vultures. There were certainly some snow geese there. And again, important to realize that the number of tests does not equal the number of dead or affected birds, especially for geese, as you saw in the news, where there were hundreds or thousands of animals affected in a group. Now, when it comes to some of these species that are listed here, so the raptors, the things like the eagles and the hawks and the owls, just because of their nature, those are much more likely to be representing individual animals. And so it does raise some interesting questions, and some of the things that then, Dr. Monkla's lab can think about is, are there certain species that are more susceptible? Are there certain species that are more likely to be spreading it to others? Just to finish my comments here, I just want to, again, thank you for the privilege to be able to come and speak with you today, but that I'm also very, very proud. I'm part of a robust disease and surveillance system here in Pennsylvania that's protecting human health, it's protecting animal health, environmental health, and ultimately food safety and security as well. I think it's important as this outbreak persists. It certainly highlights the importance of ensuring our laboratory capacity, but it also means that we need to look at what we could do to be doing more. You've heard from Dr. Moncla how her work is helping us better understand and mitigate the impacts from highly pathogenic avian influenza. And then I'm going to turn things over to Dr. Hensley, who's going to discuss how vaccination can play a role in the future. Thank you.
Okay. Let's go to the next slide. So I'm going to talk first about human infections, what we know about the human infections that have occurred within the United States. So we're going to start here with the slide from the CDC. And if you can look at the numbers here, we're up to 69 human infections, confirmed human infections. Now, this includes 41 cases from those working with dairy cattle, 23 cases from those working with infected poultry, 2 from other animal exposures, and only 3 from an unknown source. Okay, so the bottom line is today, as we stand here in February 2025, your risk of H5N1 infection for the common person walking on the street is actually very low. Most of these infections are with humans that are interacting with these infected animals. Now, we know that this is a gross underestimate. For example, a serological study which measures antibodies to detect human infection, so not active infection, but just looking at whether or not someone was infected in the past. These kind of studies have revealed that vets, for example, that are working with infected cattle can be asymptomatically infected. And so this number 69 is likely a gross underestimate. Next slide. Okay, so the first step of a virus infection, that virus has to attach to a cell, either in a bird or in the case of humans, in the upper airway. So most of the cases that we've seen in humans so far have been relatively mild. And my lab has learned that this is the case because these H5N1 viruses, while they bind very efficiently to avian cells, they bind very poorly to cells of the upper airways of humans. Next slide. So what we know, we've been studying these viruses, and when I say we, I'm talking about the community, the greater research community for 2 decades. And we know that specific changes in the virus can switch the ability of the viruses to attach from an avian cell to a human cell. And they're basically coordinates. You can think of these as coordinates on the virus, and they all have a number. So for example, if we look here, this is a structure of a protein that's on the outside of the virus called hemagglutinin. We know, for example, that changes at coordinate or residue 226 can switch the tropism of these viruses from binding to avian cells to binding to human cells. Now, the big concern here, you can say, great, right? We're in a situation, obviously a huge problem for agriculture, but maybe we don't have to worry about human infections. You might be thinking that right now, but the problem is that these viruses change all the time. And we've learned that single substitutions in this protein called hemagglutinin can completely switch the ability of these viruses to infect human cells. Next slide. Okay, so most of these cases have been mild, as I just pointed out, but you've heard that there have been at least 2 severe cases here in North America. A teenager in British Columbia almost died. She was on life support for about 3 weeks. My understanding is that she had a lung transplant. Lucky, she is now out of the hospital. This happened about 2 months ago. And we've all heard about the case in Louisiana where an elderly gentleman did pass away from an H5N1 infection. Now, when we went in and sequenced the virus from these cases, and we looked and we asked the question, are there changes in the virus? Do they look like the same viruses that are circulating in birds? What we found is that the viruses had a single mutation. And guess where that mutation was? It was at residue 226, the one that I just laid out, that we know as scientists increased the ability of this virus to infect human cells. So we have 2 very severe cases in North America. Both have this change of the virus at a single residue that we know can increase human adaptation. Now, what we think happened here is that these viruses adapted to humans, to these individuals over the course of the infection. And the good news, as was pointed out earlier, is there is no evidence of human-to-human transmission. That's the problem. Okay, obviously this was not a good scenario for these 2 individuals, but it will be a disaster if this happens again, and now we see a close contact get infected, and then another contact get infected. This is what needs to happen, this switch, for a pandemic to occur. It might not be all the steps that are required, but this certainly has made us nervous to see these substitutions creep up. Next slide. So we've been working on developing avian flu vaccines, and to be honest, we originally started this work many years ago, just studying flu vaccines in general. And we have now tailor-made vaccines to match this specific type of H5. Next slide. So our conventional flu vaccines are actually produced in all things. I don't know if everyone realizes this. You might just be scratching your head. Our conventional flu vaccines are produced in chicken eggs. Can you believe that? It's this old process where we take live virus, we infect fertilized chicken eggs, and isolate virus from what's called the allantoic fluid of a fertilized chicken egg, and that's inactivated, and we purify proteins from there. And this is a little too small to see, so I won't walk you through it, but the bottom line is this process takes a long time. And during the 2009 pandemic, you remember the swine flu of 2009, basically by the time these vaccines got rolled out, the initial wave of the pandemic had already concluded. Next slide. So we've been developing mRNA vaccines. I'm sure everyone is aware of these vaccines. We've been working on flu mRNA vaccines well before the COVID pandemic happened. And here's a study that we published last year. This is an mRNA vaccine expressing the hemagglutinin protein, so the external protein of H5 viruses. And in this experiment, we vaccinated ferrets, and then those ferrets were exposed to live H5 virus. And I love this slide because it's fairly simple. It's pretty straightforward. You can see that all the vaccinated animals survived, whereas the unvaccinated animals all died in this experiment. This vaccine is very immunogenic and protective in these animal models. Next slide. Now, of course, the mRNA vaccine can be rapidly produced. It can be tailor-made very quickly. It doesn't have this process of egg adaptation. And although, I think this is something we should certainly pursue for testing in humans, it hasn't escaped our attention that we can use these vaccines perhaps to reduce the viral burden in livestock. Can we use these vaccines to protect chickens, for example? Can we use the vaccines to protect cows? And we just initiated a study with Dr. Gary Althouse, who's pictured here in the New Bolton Center, which is where we have our large animals at Penn Vet, to test the immunogenicity of these vaccines in cattle. Do these vaccines elicit immune responses in dairy cattle? And I tell you, this process, I will just conclude by saying this process of mutations, okay, happens all the time. You're infected with a seasonal flu virus today, the virus is going to be churning out random mutations. Now, it's like playing the lottery, okay? Those mutations are random, but the ones that have a selective advantage are the ones that emerge. And what I'm concerned is that we have so many of these poultry infections, we have so many of these cattle infections, inevitably humans are going to continue to get exposed. And although the current state is that these viruses that are circulating today have a very poor ability to infect humans, that you played a lotto today, you played a lotto tomorrow. Guess what? If you buy 10 million lotto tickets, the chance of having that mutation that increases human adaptation is going to be increased. And so in my mind, the most important thing we could do right now is to try to reduce the viral burden in poultry and cattle. Next slide. So my summary is simple. I think I just summarized it. The humans are really the ones that are working closely with infected animals. Those are the ones that are high risk. I think that we're at a point of this situation where we should consider as a country of vaccinating actually, people working with poultry, people working with cattle. I know that has been discussed on a national stage. The virus doesn't bind well, but we know that can change literally overnight. And I think we have to continue to invest in these H5 vaccines that could potentially be used if there's a human pandemic, and also to curb, as I just said in the last slide, the amount of virus that is circulating in cattle and birds. Okay, thank you for your time.
Boy, that was simple. Science, amazing, very complicated, but thank goodness for all your great work, and I mean that sincerely. Too often our lives are so busy we don't think about, why our lives are as good as they are because of the research and all the scientific things that we have learned over the years. Before I open up for questions, and I'm sure there will be plenty of questions, when I call on you, if you could just repeat your name because I can't see everyone, and then you'll be able to answer your question. Before I open that up, I have a concern about what are the other countries doing because of the fact that these birds flew from somewhere to here, and now they are infecting us. So now we're dealing with it. I want to know what has transpired in the other countries where these viruses have occurred, number one. Have they developed vaccines? What kind of scientific work are they doing on this? It's concerning to me that it is basically a 2-3 year event that is really taken off. And of course, we're concerned about our humans' lifespan and so on. But from the standpoint of the ag industry, when you're eliminating 160 million chickens, it's definitely causing problems. So could you go back? What is happening in the other countries? How have they dealt with this issue? Have they improved anything? Or is it just a matter of natural phenomenon that these birds will now pick this up and then migrate, and then over a period of time it's gone naturally? Or do we have to play a role all over the world? Dr. Montclair?
I can take that one. Yes. So highly pathogenic avian influenza has a somewhat complex history that I could bore you with, but the short answer is that these viruses emerged in Asia in 1996 and then have subsequently spread worldwide. The viruses that were circulating globally before 2020 were primarily spread in poultry. So there are countries with endemic H5 in their poultry systems who have been vaccinating their poultry for years and years. These include Vietnam, Egypt, Indonesia, and China. Those vaccines have been somewhat effective, but not entirely effective for eliminating these viruses from their poultry systems. It's hard to evaluate whether that's because of how widely spread these vaccines were applied, some immunology involved with how effective they were, or some combination of both. What's changed since 2020 is that the viruses have evolved kind of naturally because they've been circulating for 20 years. Since 2020, this lineage of viruses that's currently circulating here, called clade 2344b, emerged, which are just better adapted to circulating in wild birds. So since 2020, these 2344b viruses emerged and established in wild birds in Europe. Since then, we were sort of some of the last continents to receive these viruses. So they slowly spread throughout Europe. They now have gotten to North America. They've spread to South America. The only place that doesn't have these viruses currently, this particular clade, is Australia and New Zealand. So they're even in Antarctica now.
Sorry, what have they done in Europe? What kind of collaboration do we have scientifically?
Well, it's really challenging so there are people working on this in Europe. Some countries, I know France has begun vaccinating some of their poultry populations with, I believe Dr. Hoffman may be able to speak to more in depth. But the central challenge remains that these viruses are in wild birds, which are, of course, very hard to control and vaccinate.
Okay. Do any of you want to make a comment on that?
I would just add that at the global level, we need cooperation, communication, coordination. That comes through our agencies, the CDC, it comes through the WHO.
Okay.
So the more we withdraw ourselves as a nation from those cooperative agencies, we're going to know less and less about what's going on. But vaccination is sort of the norm in several other countries, many other countries.
Okay.
I will say globally, the world is looking at the United States just in astonishment of how we've treated the cattle situation. I mean, it is alarming. The USDA is certainly putting in measures to curb this. But countries are looking at us saying, what the heck is going on? They are not testing the cows. They are letting this thing get out of control. And the virus is in the cattle population. What you're going to, and what you see, and Luis has pointed out, you're having spillover now from cows back into birds. You basically, in North America now, just have a steady supply of avian flu. So if anything, I think the rest of the world's looking at us in our lack of response of how we're handling the current situation.
That's really disappointing. I have 18,000 other questions, but I'm going to pass the mic on to our chairman, Representative Mao.
Thank you, Mr. Chairman, and thank you all again for your testimonies. This is an issue that's extremely important to all of us in the ag world and health world. And Doctor, you said something that just ran a chill up and down my spine about this thing has the ability to morph itself into something and mutate into something that can attach to human beings. My question would be on that, and I don't want you to answer it, is what's next? Are we going to have another pandemic like the COVID virus that spreads through here? But that being said, something I'm sure all four of you caught on the national news. I caught it yesterday morning. Our U.S. Ag Secretary Rollins was speaking about the avian flu, saying that there is a vaccine that is now being tried, and they're introducing it currently into our egg layers, because I understand, and that was a question, why just the egg layers? Broilers, a lot of foreign countries won't accept our imports that have been vaccinated, so I get that. But where do we stand with that as far as introducing a vaccine? She talked about it when I caught that in the news as though this is being rolled out now. And my antennas both went up immediately on this one. So if you can elaborate. And that will be the only question I ask, because he's got a list here a mile long.
So I'll be brief. There are stockpiles that are being accumulated by the USDA of vaccine. Keep in mind, these vaccines are all different. Some of them contain RNA, some of them contain virus, some contain inactivated harmless virus, and some are proteins. So they're being stockpiled, they're being tested, and the other point I wanted to make was that although stamped out is the approach that we've taken, and biosecurity is the approach we've taken, and the USDA has not sort of put forward a plan for vaccination. They are testing, they're challenging birds and testing the effect of these vaccines, but it's really important that we think about this as sort of a global issue where birds that are longer lived, like layers, genetic stock, exotic birds, and backyard birds, should be our initial target. We can all agree that layers are around for a while. Economically, there's a strong basis for vaccination, and broilers could be next. So I think there is potentially a multi-layered sequential plan that we could, and that we've actually recommended for a couple of years now, to think about rolling out a vaccine, targeting backyard birds, targeting layers. So I think probably USDA is thinking in that line, and that wouldn't disrupt the export market for broilers right now. So I think there's a model that would work. And then layered, I think Scott made a really important point. We can't neglect our farm workers. We got people that are in contact. Veterinarians are one of them, so I'm going to speak for veterinarians because many of them that were infected, several of them were veterinarians. But farm workers need to be protected. So there's another layer of protection. If we don't go to the complete public, we can target the vaccine to farm workers to protect them and protect this from becoming a pandemic.
Thank you.
Yeah, thank you very much. For those now that I'll be calling on, everyone will be allowed one question so that we're able to get to as many people as we can. Next, Chairman Rapp.
Thank you, Mr. Chairman. Thank you, testifiers. This was very informative. I come from the Northwest, and my constituents have a lot of concerns these days about the vaccines, especially the COVID vaccines, and the what many feel were harmful side effects, from those vaccines. So my question regarding the any of the vaccines, if someone is consuming a vaccinated chicken or something from dairy, have you tested how the bird flu, especially if it's the mRNA vaccine, will affect humans if they consume a vaccinated chicken or cattle, especially since now we see what has been published, all the potential side effects of some of the COVID vaccines. So what are your concerns, if any, and could consuming vaccinated chicken or dairy products be not necessarily the meat or the milk, but the vaccine itself be harmful to humans?
The quick answer to that is we don't know. And I think that it's really important to consider the safety of food and everything that we're putting into the food system. There are many vaccines that are issued to dairy cattle, swine, poultry at this moment that have been utilized safely and to protect the agricultural industry. Every one of those vaccines has to be tested on its merit for its protection and its safety. I think that's why we have a great system through the Center of Veterinary Biologicals at USDA to evaluate vaccines. And vaccines, whether they're mRNA, whether they're adenovirus associated, or whether they're protein vaccines, all go through this process of challenged manufacturing, challenge studies, and safety studies, rigorous studies. I'm not going to comment on the COVID vaccine. I think that there's a lot of information and misinformation about the COVID vaccine, and I'm not here to argue that one way or the other. But I would argue that we're consuming RNA all the time, for example, in our food products, and we're consuming food products that have received vaccines. And so far, those have been very safe products. The vaccine-related immune response and the products that you're consuming have generally never been associated with human illness. So I think that's not really our focus until we get to the point where we're doing safety studies. If safety studies in the birds, and then later, if they're approved, we start to see epidemiological evidence of public health risk to humans, then obviously the health system will act on that. But I don't believe that that's a risk to. I think that's a very small risk to take for the price of protecting an entire agricultural industry. I don't think the risk assessment, the value proposition, is there to stop the issuing and testing of vaccines. We've got to test the vaccines, and we've got to go forward and make sure that those products are safe. So I think it's really important that you consider the fact that vaccines are now being used widely and they can be used safely, and that we can repeat that. That may just be my opinion.
Thank you, Doctor. Next, we have Representative Lawrence.
Thank you, Mr. Chairman. I'd like to thank each of the panelists for being here today. Eggs used to be cheap protein. I think everyone in this room is concerned about the escalation in prices. There's been a lot of conversation about the difference between the American model and the Canadian model of egg production. Layer flocks here in Pennsylvania and across the United States often number in the millions. And I'm not going to tell you I'm an expert in Canadian agriculture, but from what I understand, generally laying flocks in Canada are much smaller. And so if a bird tests positive and the entire flock has to be euthanized, there's a tremendous difference in, impact not just to the farmer, but to the public in general when you're talking about euthanizing 1 million birds versus 40,000 birds. Certainly a large operation brings economy of scale, cheaper egg prices, and good times. But I have to wonder to some extent how sustainable that model might be given the situation that we're facing right now. It doesn't seem like this is an issue that's going away. I mean, I just think, how many times can we kill off millions of birds and expect to have eggs at the supermarket when we go? So my question to you is, as policymakers here, should we be looking to incentivize something like the Canadian model? Should we be looking to encourage more smaller operations across the Commonwealth and maybe across the nation to provide a degree of resilience against large-scale losses of laying hens?
I think that's an excellent question. I think the diversity of operations is what makes Pennsylvania strong, and I think Pennsylvania is a model for having a mixture of small and large scale and combined purpose farms. And I think that's where we're going to get the most resilience and protection from these different types of emerging infectious diseases, for example. So yeah, I don't think that any sort of homogeneous agribusiness model will work, because both will be at risk at different times. So I think, again, a mixture of models is usually considered in agriculture economics and in terms of animal safety and food safety the best approach, and that's what we have.
I would also just like to comment that there are some things that Pennsylvania has done really, really well. So Pennsylvania has, as you all know, a long history with highly pathogenic avian influenza, and as a result has really strong biosecurity plans in place that do help producers. So we've noticed that there is a fair bit of variability across the nation in terms of biosecurity plans and how well those are followed. And biosecurity really is still effective and a useful thing to really push home to producers. And so these long-term relationships really do still help, even though that we're not exactly where we'd like to be.
Yeah, I just think about, as you're correct, the avian flu is not anything new. This was an issue with Secretary Brosius during the Ridge administration. But I guess, I think we're the only state that's taking this issue seriously enough that we're putting substantial resources towards it in the state budget. Certainly I'm supportive of. But I just wonder if maybe some of those resources should be looking at, are there other economic models to be looking at for laying hens? That's really my question. And I'm happy to hear any of your thoughts on that.
Unfortunately, that is not my area of expertise, and so you guys are really the experts here on policy.
Thank you very much. Next, Representative Takak.
Thank you, Chairman. Lot of information to absorb. The increased virulence, I guess, in the wild bird population, which is causing this sort of cross-contamination, for lack of a better word, between the wild birds, the domestic birds, and now the cattle. As that virus, and I don't know whether it's the D11 or you mentioned 234B, whatever. Sorry, I get lost in those numbers. That increases the risk of additional single mutations that could then increase that virulence or the mortality and the morbidity of the virus. Am I correct in that? And if so, is there anything that we can do in terms of preventing or trying to limit that? The other thing that I'm worried about is not just farm workers, but if this spreads into the wild population, there's hunters, there's people out, enjoying the outdoors. The risk of spread of this is increasing. So I wondered if you could just comment on, your thoughts on that issue and what, if anything, we can do in addition to what we're already doing.
Yeah, so, it's a good question, right? And there are many different, what we call genotypes of H5N1 that are circulating. What we don't know is, are some of these genotypes more likely to adapt to humans? It's worth noting that the British Columbia case, as well as the Louisiana case, are two severe cases, were from this D1.1 genotype. Now, everything that's been circulating in cattle up until about a month ago was a different genotype. So now all of a sudden we have this virus that has been linked to two very severe human cases. Both of those cases were direct bird to human. Now we have this in our cattle population. One of the most important things we can do today is to try to stamp out the spread of D1.1. And Luis just mentioned that's in Nevada and Arizona. Now, so far we have on record 3 introductions of bird into cattle. If we start seeing this in Pennsylvania, for example, because there's a lot of this D1.1 in birds today, that's a lot harder to control. We can control the movement of cattle if we test and we're good about it. Once you have these viruses in wild birds, and if they continue to make this jump to cattle, it's going to be a real problem.
And just to be clear, when you say cattle, you also mean dairy cows. That's a huge. It's not just
dairy
meat.
cattle.
It's dairy cattle,
It's dairy cattle.
which are a big issue here in Pennsylvania.
And believe it or not, the virus is being spread through infected milk. That's the primary way that this virus is being spread among cows. The virus infects the mammary glands of the cows, of these lactating animals, and the amount of virus that you find in the milk is very high. And we think that the virus is actually being spread in dairy cows through the milking process itself. Infected milk gets on the milking machines, you bring in another animal, and then that infects that animal. It's a real problem in dairy cattle. But we do worry about this D1.1 and its ability to adapt to humans because it has been linked to the 2 severe cases that we know about.
Just a real, very, very quick follow-up, Chairman, is that the D1.1 that included the 50% mortality and morbidity and the 900-plus cases in the Western Pacific, was it that same variant or was it something different?
D1.1 is relatively new at this point.
I just want to add to something that Scott said earlier. I just want thing that he said earlier. If you walk out of this room, if you want to remember one thing, what we have to do is reduce the total virus load, the amount of virus that's circulating amongst domestic animals and humans, of course. Okay, so whatever you do, you won't cap this off because you're not going to magically change the amount of viral load coming from wildlife, migrating wildlife. You can improve your biosecurity. That reduces the virus load exposure because it reduces circulating virus in a poultry or dairy operation. You can vaccinate. You can do other things. But you've got to reduce right now the virus load. For 2.5 years, this has been growing. You have to reduce the viral load. So you need to start thinking about ways to cut that cycle. And that's what we learn is the fundamental principle in stopping an outbreak. You have an outbreak on your hands, on our hands. We have to slow down the virus load. So when I talk about vaccination, I'm talking about that is an option to reduce the viral load. And so when we talk about better biosecurity, that's a way of reducing viral load. And then all of these strains will have less exposure and less probability of human-to-human transmission.
I would ask, Doc, that you put that down on paper. Step 1, step 2, step 3, step 4, step 5. That's why I asked you what was happening in Europe where the birds originated or wherever they came from. What status are they now? What have they done? Is it still proliferating throughout the population, or has it gone away? What have they done to address it? Okay, next we have Representative Zimmerman.
Thank you, Mr. Chairman, and thanks to the panel for your testimony. Appreciate it. So my question revolves around the PCR tests. So now that our broiler houses are being tested prior to going to slaughter, and we've had some houses where there was no dead birds, but they tested positive and were depopulated. Is there ever a time that some of these flocks are actually retested? What's the likelihood of false positives when it comes to PCR tests?
Everybody's looking at me, so I'm not going to pretend to be the PCR expert in the room, but they're all looking at me in terms of doing that. And I think what you're asking is about confidence in our test results. That's the question,
Correct,
right?
Because we get that question every day.
No, you bet. And so, in terms of mentioning, earlier, in terms of how we are placed and in terms of how we are networked at both the state and the federal level. So what it means to be a non-member laboratory, right? So not only are we meeting some high standards in everything we do, not just our highly pathogenic avian influenza testing by being an accredited laboratory. So we're accredited by the American Association of Veterinary Laboratory Diagnosticians that has standards for qualifications, for training, for facilities, and all of that in terms of, the expectations. And I think what you're getting at is if you were to take the same sample and to give it to me today, tomorrow, and 2 weeks from now, that I better be getting the same result because real life decisions are being made based on those results, correct?
Correct.
So the other thing that we get by being a non-lab is we do have another standard to meet in terms of having our personnel proficiency tested on a regular basis. So annually, those folks are being proficiency tested again. Do the results they get match with what they're getting at the national reference laboratories? And the additional layer to that is that every time that we do a test, and it's sort of an interesting semantics thing, is when we get a result that is not negative, we call that a non-negative result, which is kind of silly, but that's the semantics, because the only laboratory that can actually declare a result positive is the National Veterinary Services Laboratory in Iowa, which is the nationally recognized reference laboratory. And to your question, that's how it works in every country, that they have a national reference laboratory. We have not had a situation where our results in the Three Paddles labs did not ultimately hold true when they went to the Iowa lab. So because of that, in Pennsylvania, what our state veterinarian's office chooses to do is when we get that result, automatically, in fact, same day, those samples are on their way to that national reference laboratory for confirmatory testing. But in the meantime, we mobilize all of our resources to quarantine that premise and to do the depopulation again, so to quickly get out in front of that infection before it can spread further. And they've done that with confidence because we have repeatedly given them results that have then come back and been successfully confirmed at the national laboratory.
PCR tests and ELISA tests are very different.
Yes.
But PCR tests can actually be adjusted for sensitivity, correct?
And I think what you're getting to, and I'm gonna look down the row and see if anybody else is gonna help me a little bit. But what you're talking about is when they talk about the CT values or their cycle threshold values, right? How they decide that a positive result is positive. And again, that comes down, you're right. I mean, within every laboratory that's doing any kind of test, right, in terms of having some information about how it performs in that individual laboratory in their hands. But we're also following in terms of some national standards as well, in terms of where those thresholds and cutoffs are. I don't know if anybody else has anything to add to that.
I think what Dr. Murphy is saying is that the chances are extremely small that those are false positives. They've been repeated in a national lab with different technologies using the same types of controls but separate and independent investigators. And those controls are spiked in and very rigorously managed, and those thresholds of positive versus negative are rigorously evaluated and repeatedly evaluated in quality assurance. So I think false positive is very, very unlikely in influenza especially.
Okay. Thank you. Thank you, Mr. Chair.
Thank you very much. Next, Representative Borowski.
Thank you, Mr. Chairman, and thank you all for being here today. Your work is very important, it is essential, and it is necessary. And we are grateful to have you and your expertise doing that for us. My question, because some of my colleagues asked some of the questions I had prior, but what can we do to help you in your work? I mean, this is obviously an extremely impactful virus, not only from a public health perspective, but also our economy. So what can we do as legislators to help you and support you in your efforts?
Oh, thank you so much for all of your questions, but for that question as well. I think number one, the most important thing to do is to take the information that you learned today and take it back to your constituents and stakeholders and look at this in the eye and say, this is what the data shows us. We're at this situation, and be knowledgeable as well as to be critical of what's going on here. Number two, I think there will need to be some adjustments in both policies and also investments in how we're approaching this outbreak. And I think some of the talking points have already come up about how we need to tighten surveillance. Pennsylvania's doing a great job, but we need to keep that up. Keep the mandatory, bulk testing, and keep the testing going through the standard channels through the NOMS labs and up to the critical labs. We have a number of investigators here. Dr. Henley to my left, who runs the Influenza Center, has been funded for over a decade by the federal government, and there may be potentially shortfalls in the future. From federal funding. Dr. Monkla's lab is a primary investigator-driven lab. She's got a lab of about 10 people, is one of the key experts on phylogenetics of influenza in the country. And if we see shortfalls in federal funding and we want to keep Pennsylvania agricultural industry strong, we may have to make investments in some of the ongoing basic research and surveillance that's going on. The other area is, of course, communication, and then finally, we may need investments in vaccine development. We may have to. Pennsylvania's always been strong and been out front on many things. In this case, we have an opportunity, as we have done in the past, to be leaders in the development of new protective vaccines for our agricultural industry. And I'm afraid we're at that point where we're going to have to think about that and discuss that further. And where those investments will come from, the private industry, from the federal government, from animal health companies, or from the state is up in the air. But I think that we're a center that can work towards all of these goals collectively: better surveillance, better tracking, vaccines, protecting human populations, working together across veterinary and human medicine. So these labs and this kind of work that they do may require investments from the Commonwealth. Does anyone else want to? Lisa, do you have any comments on resources or things that you see coming down the line?
I mean, sure. I'll just add, and you mentioned Dr. Hensley and Dr. Moncla, the federal funding that they receive, and certainly while our paddles labs are primarily funded by the state, we also do receive direct funding from USDA, from FDA as well, to help support our work, to support our quality systems that I was mentioning earlier as well. But also what we get too is those resources, those personnel and those connections, to those programs, right? Those program offices and those personnel that help us with proficiency training, with all of those other types of things. So, in terms of all of those different layers that help ensure that we're doing what we need to do on a daily basis, it's all connected. Thank you for the question.
Yeah, and I'll emphasize the whole federal part. I mean, we're sweating a little bit. My center that I run, it's about $10 million a year we get from federal spending. That goes away next month. Guess what? The whole staff's getting laid off. We don't have money to pay them, right? So doing the surveillance effort, sequencing, doing the basic science studies, try to understand how mutations affect the ability to infect human cells, developing vaccines, that all goes away. And so I would be lying to you if I were to tell you that we aren't all sweating. We're really nervous to see some of the conversations on the federal level as far as it relates to funding the surveillance effort and vaccine effort.
Thank you very much. Next, we have Representative Jones.
Thank you, Mr. Chairman. My question surrounds Dr. Hoffman. You referred to the stockpiling of vaccines, that's already occurring, whether they be mRNA or others. But the stockpiling of vaccines. My question is, what are the names of the companies who are producing these vaccines, and where are they located? Preliminarily, that's my question.
Yeah, I don't know the exact nature of the vaccine that's being stockpiled by the USDA. In terms of animal health companies, we have Zoetis, which was formerly a Pfizer, spun off Pfizer Animal Health, headquartered in New Jersey. Much of the headquarters are in New Jersey. I think they have other headquarters, Connecticut, and so on and so forth. We have Boehringer Ingelheim, and we have Merck. These are the big three animal health companies. And we, not I, but Scott and another investigator have been recently publishing on these vaccines. We've had an article come out, again, not we, Chris Hunter, from Science Immunology. Once these come out in a journal, and once you establish some pathway forward for testing those vaccines, we start having conversations with animal health companies, and we're right there right now. So I think those three companies are really important. Merck is in the Midwest. You asked about BI, Boehringer Ingelheim headquarters. I think they're New York, but I have to go check to where the current headquarters are.
And I believe Moderna received
Moderna, of course,
nearly $500 million in federal grant money.
Yes, Moderna develops human vaccines. It has not been engaged in animal health as yet, although there's been some discussions about certain diseases that affect both humans and animals, like Nipah, that have been in discussion with Moderna. But no, Moderna is not a vaccine company that we would approach initially because they don't have the pathway forward for challenge and safety testing in large scale.
Okay, understood. And Dr. Hensley, you referred, to the chairman's question earlier about what are other countries doing to our North Canada, to our South Mexico. I don't know, obviously their practices are not the same, but you said that you referred to the world looking at the United States and thinking that we're doing less than. I struggle to understand that inference, or with everything that we have done and everything that is being done. And I still remain curious as to what is happening in Mexico, where we don't see shortages of eggs, what is happening in Canada, and then what's happening in Europe as well. I would love to know what those nations are doing to address high-path avian influenza.
Yeah, I mean, I could let some others comment on this, but in the United States, what's going on in cattle is really been talked on a global level. I mean, we've been worried about this virus for 20 years. Here you have it in a mammal and spreading widely between mammals. And what you get from other parts of the country, the criticism is that we're really not doing enough to curb the spread within cattle. You can control a virus that's passed from milk by 1,500-pound animals that don't have wings, right?
But there is, just to be clear, there's no threat to our milk supply because that infection is killed. Our milk supply is safe, correct?
Unpasteurized milk is not safe. Pasteurized milk is completely safe. So
have there been any cases of human infection from unpasteurized milk? Because I think it's been in cattle, in dairy cattle, for several years now, since I think correct me if I'm wrong, 2021, and we've had no human cases of infection from unpasteurized milk. Is that correct?
So everyone should feel comfortable drinking pasteurized milk 100%. As far as unpasteurized milk, no, the virus jumped in 2020 2024 or the end of 2023.
Okay.
Now, as far as cases, documented cases, there were likely cases out in California of kids getting infected with H5 from unpasteurized milk that they bought off in the grocery store. So I
Those
don't know.
are likely but unconfirmed.
I think they remain unconfirmed.
They do remain unconfirmed. The cases however, we do know that there have been a number of fatalities in house cats that have drunk raw milk that was infected. And so if you feed raw milk to these house cats, they almost uniformly die. So it is risky.
Point out one other experimental thing. So yeah, if you see cats on these dairy farms, that's one of the things that actually led to the identification of H5 infection of cows. They found that the cats on the farms were getting infected. If you give infected milk to mice, for example, they drop dead. Now, the threat to humans through unpasteurized milk, it's not clear, but it certainly is a threat. I mean, pasteurization takes care of it. There's a lot of reasons you don't want to be drinking unpasteurized milk, but this is just another reason. But the general public should feel very comfortable with our milk supply in our country, within Pennsylvania, as long as it's pasteurized. Studies have shown in the lab that the virus is completely inactivated by pasteurization.
And it's not killing the cattle, correct?
It does lead to some deaths in cattle. What you see is a reduction in milk supply. Some of the cows have a hard time ever fully recovering to produce the amount of milk that they were producing before infection. But in general, it's not a lethal virus in cows.
Okay.
I think 1% to 2% lethality might be the number that I've heard.
Thank you very
guys.
much, Representative Jones. Thank you. Our last question, Representative Stanbaugh.
Thank you. You sort of already touched on what I was going to ask. So you're advocating, obviously, to drop the viral load. Vaccination is the way to really get ahead of this. Is that correct?
Yeah, I think biosecurity as well as vaccination.
All right.
Yep.
So at that point, we have a lot of policy decisions to make as a country and as a state. We have market agreements obviously are going to be impacted, trying to sell mostly chicken, possibly beef overseas, that kind of thing. The virus, though, changes like flu virus does every year. That's why our flu virus shots are always adjusted every year for the kinds of flu variants that they see, mostly from Asia coming in the United States. So on Australia, I guess they look at the southern hemisphere first and then they modify the flu virus. Are we going to be looking at that same scenario with avian flu virus?
Well, with this particular H5 virus, again, from 2020 to 2025, over 5 years, these viruses actually evolve much slower in birds than what you see in humans. Vaccine antigens that are based on the 2020 version of this virus actually elicit pretty good cross-reactive immunity to the viruses that are circulating today. Now, we update these vaccines all the time in-house in our lab. But if there were a pandemic tomorrow, I think some of the vaccine stocks that are based 5 years ago, for example, on strains 5 years ago, would still provide some protection.
Thank you very, very much. And on behalf of all of us that are here today, I want to thank all of you for your very important information. I am, though, going to give you that assignment. If you would write down, give us our assignment. What are the steps that we need to take? Let's continue the conversation. And also, I think it's obvious that all of us here are very much concerned. Whatever we can do, we certainly will work together to do that. And as a result, it is key that we maintain contact. Okay, so the doors are open. It would be just absolutely catastrophic if this gets out of control. We've seen already the difference in our prices, and just to imagine that you have to kill 160 million birds is just unbelievable. Once again, I say thank you, but before I pass the mic over to our good person from the Health Department, I want to thank, the Health Committee. I want to thank all the members of the Health Committee as well, and we will continue this conversation once we finish here as well. So at this time, thank you so very much from the Ag Rural Affairs Committee, and now I pass it on to Representative Kozarowski.
Thank you, Chair Persinski. And on behalf of the Majority Chair, Dan Frankel of the Health Committee, I really appreciate all of you being here. It's very important for us to see you here on this side of the table, veterinarian medicine, and you here, human medicine, because it affects all of us. And I think the takeaway for us here in this room is something specifically that Dr. Hoffman said. We have to decrease the total virus load. And to do that, it takes research, it takes vaccination, and we in this room have to remember how important it is to fund researchers like yourselves, science like yourselves. It's very important for us to understand what that all comes down to. So collaboration, funding, and communication, I think is the real takeaway from this hearing. So I'm grateful for you being here, and I hope we all do realize how important it is to make sure that we support you, and the support we can do on in our room here in this aisle is to make sure we understand how important the funding that you receive. So thanks for being here today, and we really appreciate it.
And one final comment, because I know that there's quite a number of folks that have questions. I'm going to ask, if possible, if you'd stick around just for a couple minutes, so the representatives that didn't get a chance to ask their question, stick around, and we'll be more than happy to share some time with you, okay? Once again, thank you all so very much. Your information is absolutely vital. We appreciate it. Thank you.